When it's your emergency, you want expert care, performed in a state-of-the-art facility, located conveniently with easy access. Today at Van Wert County Hospital, it's time to merge expert care with a new state-of-the-art facility with easy, convenient access. To accomplish this major improvement in health care to serve the greater Van Wert area, the hospital has launched a $4 million capital campaign to build a new emergency services facility. The need is immediate, and Vice President of Nursing Pam Baker explains why.
80% of the patients that get into a bed upstairs in our hospital come through our ER. So a good experience in our ER will hopefully lead for those individuals to come back to our hospital for further services, which increases the whole viability of the organization to serve our population for years to come and invest in further services.
Improvements in the facility will create a favorable treatment environment, including 11 private treatment areas to welcome patients and their families. That's double the current spaces and will eliminate the necessity to send patients elsewhere, which is occurring at an increased rate. In addition to the enhanced care environment, a new emergency services facility helps keep our hospital competitive. When healthcare expenditures leave Van Wert, they represent a real loss of potential jobs and income. Hospital Trustee Board Chair George Brooks of First Financial Bank talks about the economic impact of Van Wert County Hospital.
Our hospitals employ payroll and purchases of goods and services, results in an annual economic impact of nearly $48 million in business sales for the Van Wert area. The construction of this ER facility will generate a one-time impact of several million dollars. It's also expected that the new facility will increase hospital patient counts. So this building facility is a good business and economic decision, as well as providing enhanced health care.
Emergency services, with the volume of lives that it touches each year, is a project most deserving of public support. Van Wert County Hospital will fund $2 million of the $6 million expansion from its reserve funds. Drawing down reserves to entirely fund the project, according to Mark Minnick, hospital president and CEO, is inadvisable.
As we look at our 5-year capital plan, we've got projected expenditures of $20 million plus. And while we might contemplate funding the ER of current reserves, then that threatens other projects that we're looking at in the long run. And once we consume our entire reserves, we don't really have an existing collateral base or strengths in our balance sheets to continue as an independent community hospital from an ongoing financial standpoint. We have to find access to $25 to $50 million in the next 5 to 10 years. So we look at this as an opportunity to get additional funding from the community, gain more community ownership of the hospital, and help us in our overall goal of being an independent community hospital.
A new emergency services facility was an asset in recruiting the latest addition to the care team, Dr. Nat Reinenmeyer.
My wife and I chose to come back to Van Wert mostly because I was born and raised here, so that made it easy, but also because we still have family here and family support that, we know family support is essential, so it was good to be back and close to family. Well, I think we provide a great service to the people of Van Wert County and also the surrounding areas. I think that we're here 24 hours a day, 7 days a week, and people are starting to learn that we are here for them, and we have a lot of services here.
Van Wert is a generous community, and Andy Chakowski, General Chair, is confident that the campaign goal will be met.
It's ER's time. We're seeing upwards of 18,000 patients a year. 2,000 patients a year are being seen in the hallways. That's not the standard of care that our hospital needs to live to. We need to be better than that. So it's got to be now. Now is the time to make this happen. The community in the past has always supported projects that the need and the desire has been proven. The YMCA, the Kemper Natatorium, where the pool complex is at the Y. Citizens in this community have seen the need for these type of institutions. The hospital is critical with close to 400 employees that live in this community and put back into this community. This is a great project to get involved with. If not now, when? And if not this project, what project would you get behind?
The need, acute. The community benefit, considerable. The emergency services expansion, personal. Emergency health care touches everyone. You, a family member or friend, has received treatment. Lives often hang in the balance. Your support of the 24/7 Emergency Services Expansion Campaign will help ensure quality care in a state-of-the-art, attractive facility that is a main gateway for medical services for the greater Van Wert area.